Emily.
Yes, I'm ready.
I am so excited to have you on our Fun Fact Friday. You guys, I'm so glad that you joined us today. Yay! And then Jordan is here as well. She might make another cameo throughout, but this is our series of helping give you good information. Yes, babe.
If you guys do hard work today, I'll go give you a prize.
Okay.
M&M's.
Okay. Very good. Thank you, babe.
Yum.
Okay, so you guys get M&Ms after this is over. So anyways, today I have a very good friend on, and I'm so happy to introduce you guys to Dr. Emily Cooper. I'm going to let her just kind of tell you a little bit about who she is, her medical background, and then we are going to ask her some really good questions so that we can get legitimate information. Right? Okay, so Dr. Emily, tell us a little bit about who you are and your background.
Okay, thank you. First, I want to say thank you for inviting me to share some time with your viewers this afternoon. This is so exciting and something that I hadn't really started doing until I got asked to do it this week. So thankful for new doors being opened up. I'm originally from Virginia, born and raised. I went to undergrad there as well. I went to Virginia Tech. And for med school, I went to Virginia Commonwealth School of Medicine in Richmond, Virginia. I completed my residency here in Charlotte at Carolinas Medical Center Family Medicine Program, where I was chief resident. Went back to Virginia for a few years, got married, and then was recruited back to start a new program down in Anson County at the new hospital that CMC or Carolinas Healthcare opened. And after I was there for about 2.5 years, they recruited me to be the medical director over at CMC Biddle Point, now Atrium Health Biddle Point, which is a community clinic for underserved patients located just outside of downtown Charlotte, across from Johnson C. Smith University. So glad to be here.
Awesome. Thank you so much. You have been well sought after and recruited, and today is no different. So I'm so glad you're here. Okay, so let's jump right in.
Okay.
Do you mind giving us a few minutes so I can ask Dr. Emily some questions? Thank you, and I have a prize for you when we're done.
Or you do? Where is it?
I can't tell you. All right, so you know what, Doc? There have been so many myths about our pandemic situation. I see them all over, and a lot of times I cringe when I see them. And so I'm really glad to kind of have you on because I really want to just find out from you, what some of those myths are and how do you dispel them? What do you have to say about so much of the information that's going around that is just not true?
Honestly, I try not to look at it. I had to stop looking at Facebook because it was driving me crazy. These family members would send me posts or send me questions. So it's foolishness. And the one that I just try to avoid answering is, I want to say it was a meme or something where it was the picture of the person with their throat, and it was saying, coronavirus lives in your throat for 4 days before you get infected. And first of all, if it's already in your throat, sir or ma'am, you are infected. And second of all,
Yes.
since most of the people don't have symptoms for 5 days, sometimes 2 weeks, how would you even be able to do that not knowing you're infected? So some of those things I try not to look at. The biggest one that bothers me is that some people still think it's a hoax. And, you only have to watch the news one time to see that it's really not a hoax. So there are several, just a couple other ones that I have kind of collected to share with you. Is the flu shot or the pneumonia shot effective against coronavirus? No, because just to keep it simple, you have the influenza vaccine, which coronavirus is not influenza. And then you have the pneumonia vaccines that we give older adults. So those vaccines are not effective against coronavirus. In fact, we don't have a vaccine yet for coronavirus. So that's one.
Okay.
Another one is see, I'm looking at my list. So for young people, is it better to get coronavirus now so I can develop an immunity to it? Well, we don't have data to support that right now. One, we don't know if once you have coronavirus or COVID-19 specifically, if you will develop immunity. Only time will tell that. So that's definitely a myth. One that I think what most of the people are starting to understand is not true is the one where I'm young and I'm healthy, so I'll probably be fine. Well, chances are you may be fine. The mild symptoms where you kind of feel like you have a cold, that's not so bad, maybe. But even people who have moderate symptoms where they feel like they can't breathe, it's almost, I had a colleague who actually has it, and he said that it was really that sensation of a combination of someone sitting on his chest plus like he was being stabbed in his lungs. So even moderate symptoms aren't fun. So to think, okay, I'm young and healthy, I won't really be affected is definitely not true. There's just really no way to tell if you will unfortunately be one of those younger people who could have more severe illness. So those are just a couple of the myths, and depending on time I can share some more, but those were some of the big ones that I wanted to talk about.
That's so good, and it's so interesting because I've actually heard all of those myths, every single one of them, and I wasn't sure that there was like immunity that you could develop. We don't even know enough about it yet, like you said, to even really make that kind of a determination. So thank you for saying that and for sharing that. And like you said, if there's time, I want you to kind of go over a couple more. Yes, dear. Okay. So you also mentioned the speculation that this threat isn't even real. I hear that a lot. And as you mentioned, you even have a colleague that is being affected by this. This is very real. It's very serious. It's very different, very novel, as we're calling it.
Yes.
And so can you share a little bit about, your day-to-day work and what you have seen without, of course, giving away personal information?
Sure.
What has been your direct experience with this virus?
It's funny you should ask that because the first week that Atrium Health, which is the company that I work for, the health system I work for, really started looking at making changes to the way that we practice, I had a patient come in who was an older gentleman. So he was over 65 and he had other comorbidities. And his wife brought him in because she was concerned that he was confused. She said that he had been confused for the previous couple of days and she was worried he was having a stroke. So in my clinic, actually, that is a very common thing that happens. But just so you all know, so your viewers know, in older adults, especially if they've had a stroke or if they have diabetes, the first sign of any kind of infection, the most common being a bladder infection, will be confusion. So because we were so early in it and the whole talk of community spread, meaning someone has COVID-19, but they didn't have direct contact with someone, was still really new. So we get this gentleman worked up. At the time, we weren't doing gown and gloves, mask, anything yet. So we get him worked up and he does have a fever. So, but still, again, the confusion, his comorbidities is still, the first thing I'm thinking is a bladder infection. So my nurse gets a urine sample. And I go in and speak to him and his wife, and she's telling me the story that, a few days prior, he had cut the grass and had come in and was sneezing and coughing. And she just figured it was his allergies because he had been cutting the grass. And so she gave him Mucinex and those symptoms went away. So I'm like, okay. But then I'm like, okay, but he's had a fever. Okay. So we're talking some more and his urine dip was negative. So I'm like, So his urine is clean, so it's not a bladder infection. His blood sugar was okay. And so I'm talking some more and I say, well, who else, what have you all been doing? And she says, well, we haven't been out of the house. We haven't been anywhere, just like they said to stay home. And I'm like, okay. I'm sorry. Had to sneeze. That came out of nowhere. So she says, And then I said, well, did you go to church? No, church was closed. So I'm like, okay. So I kind of, I breathed a sigh of relief. And thank God, honestly, that I said, well, good. I'm glad it's just you guys in the home. She said, yeah, we haven't had anybody over. It's just us and our 19-year-old son. And my chest dropped. And I'm like, okay, what's the 19-year-old been doing? So she says, oh, he's been in and out going to work. And I was like, so at that point, I stepped out of the room. I called my nurse. I said, we need to move him to our negative pressure room, because at that point we were putting people in a negative pressure room. Now we know that that doesn't even matter. And I said, you need to put your gloves and mask and everything on, because we had to help him walk down the hallway. At this point, I knew essentially I had already been exposed, because I didn't have anything on. I had examined him. So at that point, we were paging a team that was telling us whether or not we could get a person tested. I was sending him to the hospital anyway, because his blood pressure was low. He had a fever. His heart rate was up. So basically, he was heading into what we call sepsis, where he has an overwhelming infection. So I call, and I'm going back and forth with the team. They're like, well, no, he hasn't had any exposure. And I'm like, listen, we've already had reports of community spread. It is entirely possible that this man's son has unknowingly been bringing it in the home. So they're like, oh, well, the ER will figure it out when he gets there. So he gets to the ER. They determine he hasn't had an exposure, no known contact. So he did not get tested. Well, because he was on the team that our residents manage, we have residents in my practice. I called the resident and I was like, listen, this guy is concerning for COVID-19. He really needs to get tested. So at that point, they were running a respiratory panel first to rule out flu, the other types of coronavirus, and some things. So they said, well, we'll get the RPP first, and then if that's negative, we'll do the COVID-19 test. So about 9 o'clock the next morning, they were still waiting on the RPP, which is always a bad sign, because if there's something positive in the RPP, it'll pop up immediately. So I'm like, So they went ahead and ordered the COVID-19 test, and I'm like, about time. An hour later, sure enough, the respiratory panel pops up negative. So I'm just like, you know what, he's got it. He has it. So, of course, I found out later that evening that he has it. But honestly, what I've seen in that situation and what I realized is that, God put me there for a reason as a leader. I've been really super duper calm through all of this, just weirdly calm. Not that I'm the type of person that freaks out anyway, but at this time, at the point in my practice and elsewhere, they needed a leader who could be calm, someone who could lead the way. I had to have that exposure first. I did end up getting tested and I was negative. But after that, my clinic was the first to start checking temperatures on everybody that came in the building, no matter what they were coming in for. We have caught, doing that, we've caught we're up to 5 now, 5 positive patients that way.
Okay.
And those people that patient, because we have a pharmacy in our building as well. So those people would be taken to a room. The on-call doctor would come down and assess in the full PPE, the gown, the gloves, the mask, everything. So I feel like that was my purpose. That was my point, to one, show you don't have to freak out and lose your mind. You still need to proceed with caution. We still have to take care of our patients. But we need to remember that people still come in for other things. It really could have been a bladder infection, but because I kept asking the questions, and like I said, I'm glad that I said, so it's only you all in the home. Otherwise, they might never have mentioned their 19-year-old.
Right.
So
right.
It's real, and again, if people still at this point believe it's a hoax, I got nothing.
You know what? You're so, I'm glad you said that a leader was needed, because I truly believe, I want to thank you for exhibiting that type of leadership. You were absolutely positioned for such a time as this. And thank you for leading the way, because look at what came of it. You went right into action with the new precautions of checking temperatures and all the other things that were needed, and were able to catch some other cases quickly. So thank you for exhibiting that type of leadership. I'm just grateful for you guys being on the front lines is such a big deal. Thank you so much for showing that excellence, girlfriend.
Thank you.
Okay. Um, so people are staying home-ish, hopefully. I had to go out. I co-parent my daughter, so I had to go get her the other day from her dad's.
Mhm.
And when I went out, it looked like a normal day. There was
Yes.
quite
Yes.
a bit of traffic. Now, I've been in my home for over, I guess, a month now.
Mhm.
And I go to my dental practice if I absolutely need to. We are only seeing emergency patients, like strict emergencies. And I go there to, turn the water on here and off so the sinks don't get so dry and moldy. And so I haven't been out of my home. So I don't know where these people are going, but let's hope that
Exactly.
there are some people staying home. And so let's talk a little bit about the kinds of precautions that people should be taking even while they're at home. Because people are ordering takeout, they're ordering groceries. I know I am. They're ordering
Right.
games and things to play and to keep their kids busy. What do you recommend? Like, I know what I'm doing, but let's hear it from you. What do you think people should be doing to take those new precautions?
Yeah, the first thing is they really should be staying home. Like and this is my personal opinion. I think that it was a bit of a mistake for locally uh, for folks on the news and even whatever to saying that oh, social distancing is working, we're flattening the curve when we haven't had what's called our surge yet, or the peak in that graph that they talk about. So because then people think, oh, okay, well, we're almost done and we can start to get back to normal. And so like you, I've seen more people out and about. We're doing alternating weeks where half of my doctors are in the office doing phone visits and taking care of folks who walk in. The other half are working from home, so this is my week from home. But I was just amazed last week. I'm like, where are all these people going? What are they doing? I know all these people are not essential. Like, what is happening? So, the grocery takeout thing, I don't know, because on the one hand, if you go in and get your own groceries, you still don't know who has touched that stuff before you pick it up. If you have it delivered to your house, you still don't know who has touched that stuff before you do it. So it's kind of like, I think it's reasonable to wipe off like your plastic jugs and stuff. I think that's reasonable. Obviously, for stuff that goes in the freezer, it's one of those things. I did do a talk the other day where it talked about how long the virus can live on some of the substances. So I'll share that with you just to kind of give to people to keep in mind. So on clothing, it can be up to a day. So if you do go out, just like yesterday, I had to go to the grocery store. We needed milk. So I came home and I took those clothes off immediately so they could be washed. So if you have to go out, when you come back home, just take those clothes off, wash them. If heaven forbid somebody has touched you, just go ahead and shower. Just so you can have your own peace of mind so that there's not that extra worry. As far as cardboards, so thinking about your cereal boxes and stuff, that stuff, the virus can live on that up to a day. So go on and wipe it down with your Clorox wipe. I mean, when you get it in from the grocery. And then plastic and stainless steel is 2 to 3 days. So you absolutely want to wipe that stuff. Yes.
You know what? I feel so much better because I feel so OCD because when I get my groceries in, I'm like taking it all out of the bag. I put it in a neutral area. I spray it, I wipe it, and then I throw away the grocery bags. Like, I'm like, am I doing too much? But
No,
when you speak, I'm doing the right thing.
You are doing the right thing. And cleaning the surfaces that the family uses, because like even in my neighborhood, we walk every evening. And yesterday there were a group of kids playing and riding a bike, and I'm like, oh, so that's what we're doing? We're riding our bikes together. So definitely cleaning off those surfaces, bathing the children every night, especially if they go outside, because who knows, especially if your child is old enough that you're not necessarily outside with them, you don't know what child they done hung out with and who they touch. Yeah. Yeah. So my daughter Dylan, I'm like, come on, you walking with mommy, and she loves it. We're exercising. We're exercising together. So
I love it. I love it. Okay, so bathing at night was a key thing that I heard you say because Jordan loves to take her shower. We're switching to nighttime showers because we do try to change out our clothing when we come in from our walks. We just came in from one just before this. And I was like, okay, let's switch over. But bathing at night, I like that one. Thank you for sharing that, Doc. That's important. Okay. And so, yes, I was going to ask you, with walking and jogging outside earlier in the week, or I think it was last week, we talked a little bit about just keeping longer than a 6-foot distance.
yes.
With the aerosols. Can you talk a little bit about that? Unless you have a visitor, but she can say hi.
She's gonna say hi, and then she's gonna go downstairs to Daddy. Say hi again, everyone. Hi. There's Jordan. Say hi, Jordan.
Hi. That's Dylan.
All right, go to Daddy.
All right. I'll be there. Okay.
What's my surprise?
This is the life of mommyhood.
Yes.
What's my surprise?
I'll tell you later. I'll tell you later, but you gotta behave. All right. So when we're outside, our neighbors are really courteous, and if we see someone coming like in our direction, they usually will move over because they see I'm with my daughter.
Right.
If they don't, we'll move over. But that's not excessive, right?
No, and that's my neighborhood is doing the same thing, other than the kids out last night, but the same thing. When we see people walking, if it's adults or people with older kids, they'll move out onto the street. And it was funny when we got to one of the courts in our neighborhood. So me and Dylan are walking. There's a little girl on a bike in a driveway, and she's kind of in the middle of the driveway, halfway on the sidewalk. And there was another gentleman with his little girl, a toddler, on a bike with training wheels. And so the little girl that was kind of sitting halfway in the sidewalk, she was just kind of looking, and I was like, go ahead, baby, we're not trying to get close. Go ahead and ride. And she's like, oh, okay. So she took off riding. So then the gentleman laughed because he didn't really want to say anything. So Dylan and I went out on the street so he and his little girl could pass. So it makes me happy to see that kind of thing, in our neighborhood. And I hope more neighborhoods are doing that. Yeah.
Right. It's so important. And especially with Jordan, like she just.
Are you guys still recording?
Yes, Jordan, still recording.
If someone will, it's not often, but we did have someone take care of a sprinkler, and he rang the bell, and Jordan runs out, and I'm like, no, we have to keep a distance.
Yeah.
And so, we just have to be so vigilant with our kids. Babe, is this good behavior? Do you think it's good behavior? Okay. All right, so we're almost done, Doc. I just wanted to kind of allow you now to just kind of share anything else that you wanted to share, any other myths or anything that we need to know about that are false, or just anything now that you want the people to know.
Yeah, that's great. And I think, instead of doing more myths, what I will say, because I've started to see this week in my practice, is, if you're concerned about having symptoms or that you may have it, I recommend calling your primary care physician first, because most of us already have something in place where we have a questionnaire we'll ask, or we'll refer you to a triage line or something. So check with your primary care physician first. Okay. The second thing is, if you don't have a primary care physician, and of course I can only speak for Atrium Health because that's who I work for, but I know we have a Atrium Health coronavirus webpage that's updated daily, but on that page is a free assessment. So anybody can use that. You don't have to be an Atrium Health patient to use it. And that website is atriumhealth.org/coronavirus. So if you don't have a primary care physician, you can use that. The next thing I will say is, I've had a couple of patients this week who have had some really concerning symptoms that they wanted a phone visit with me. Ma'am, I cannot treat your chest pain over the phone. I cannot treat your shortness of breath over the phone. So what I really want to help people understand, and to help your parents, cousins, coworkers, whomever, that if you're having serious health systems, this is not the time to not go to be seen. Because people do still have heart attacks, they do still have appendicitis, and these things will kill you if you let them go. So don't sit at home with serious symptoms, chest pain, shortness of breath, those sorts of things, because you're too scared to go to the ER. So just remember those things. And I know that it's a scary time. You don't want to come in contact with other people, but you still have to be aware of how you're feeling, what's going on in your body. And if it is something serious, you still got to address it.
Yes. Well, you heard it here, folks. If you're having issues, don't ignore them. But first line is to call your PCP, your primary care provider, because she or he can guide you. So, and I will post that link below. I think you said it was atriumhealth.org/coronavirus.
Yes. Yep.
Okay. So I'll post that, and I just want to thank you one last time.
You're welcome.
Coming on for Fun Fact Friday. And you know what? I hope that you come back. We'll have to have you back another time for totally different topics.
Absolutely, because I do have other interests.
Yes, she does. She does, you guys. I have the best friends. I told you guys, I have friends in high places, and she is one of them. Multi-talented, beautiful, loves the Lord, family-oriented. Lots to know about Dr. Emily. So thank you so much, girl. And I'll see you later. Thanks for coming on. Is there anything else you want to share?
No, nothing else. Just thank you for having me, and looking forward to coming back again and talk about other things.
Thank you, girl. Well, I will see you soon, okay?
Okay.
All right, bye-bye now.
Bye.